The broadcast is now starting. All attendees are in listen-only mode.
Greetings, everyone. My name is Krista Brown with the APS Technical Assistance Resource Center, APS TARC, and I want to welcome you to this webinar on the APS process evaluation, what is in it for me, with our presenters, Carl Urban and Gila Schusterman, who I'll introduce shortly. Next slide, please. Before we get started, I'd like to share a little bit of information. This webinar is being hosted by the APS TARC, which is a project of the U.S. Administration for Community Living, Administration on Aging, Department of Health and Human Services, and administered by WRMA Incorporated. Contractors' findings, conclusions, and points of view do not necessarily represent the official policy of the federal government. Next slide. The mission of the APS TARC, as many of you know, is to enhance the effectiveness of APS programs by working with partners on use of data and analytics, applying research and evaluation to practice, encouraging the use of innovative practices and strategies, and providing individualized technical assistance to APS programs. We are here to help you in any way we can. Just reach out to us using the contact information that will be displayed at the end of the webinar. Next slide. Just a quick announcement about Let's Talk APS. So announcing a new format for our monthly peer support discussions. The APS TARC is hosting 2 informal collaborative peer calls each month via Microsoft Teams, one on practice and one on program management. You'll see their time and their frequency there on the slide, so watch out for announcements and more information on how to register. And if you have not seen those announcements, please reach out to us and we'll get you hooked up. Next slide. Also a reminder that the National Adult Protective Services Training Center, NATC, has launched, and the no-cost APS Core Program e-learning courses are available for APS professionals to access. So please visit the website for additional information. Next slide. All right, now on to some housekeeping. Slide handout is in the handout section of your webinar control panel, and you may download these at any time. Please use your computer speakers to access audio and make sure the speaker volume is adjusted to your desired volume. If you experience audio problems during the presentation, we recommend that you sign out of the webinar and re-enter, log back in. Next slide. You may ask questions and share comments by typing them into the questions box at any time during the webinar. We will try to get it to as many questions as possible, but we do have a full amount of content for you today. This webinar is being recorded, and all registrants will receive a notification when the recording is posted online. Everyone today will receive an email in approximately 24 hours with a link to download your certificate of attendance, and be sure to take the brief evaluation survey when prompted. We really love your feedback. So next slide, please. It's my great pleasure to introduce my colleagues who are presenters today. Carl Urban is Senior Research Manager with the APS TARC and is the team lead for the National Adult Maltreatment Reporting System, NAMERS, and leads and/or supports the APS TARC Technical Assistance and Evaluation projects. And Dr. Gila Schusterman is a social scientist with 25 years experience in evaluation and applied research in the areas of child welfare, disabilities, education, and adult protective services. Her background includes evaluation design and implementation in small and large national initiatives. And with her background in management and analysis of large databases for use in program evaluation and policy making, she serves as lead analyst and methodologist for the multi-component national APS evaluation. So Carl and Gila, take it away.
All right, so welcome everybody. So Gila and I have been partners on this evaluation for a few years, and we're going to try to, in about 55 minutes, give you some information on it. It will not be all of the information on it, and I will probably go fast, and for that I apologize in advance, but it's the only way we can cover this content. If you came to the the workshop that we did at the NAPSA conference, it's basically the same content. We had an hour and a half there. We've got an hour here. So it is what it is, and we will probably go fast. We hope that we have some time for questions at the end If we don't have time for questions at the end, you have our contact information and you know how to get a hold of us, and we will be glad to answer any questions. So we wanted to start with this slide, which you have seen in a number of our presentations from time to time. And it just talks about the fact that in building the APS TARC, ACL was very interested in us creating this self-reinforcing cycle of using data and evaluation to help understand the APS system so we could implement best practices, we could determine service innovations, and that then is going to help us better evaluate what's going on with the system and move the system forward. So next slide, please. So let's talk a little bit about why it's important to understand APS from an evaluation perspective. Next slide, please. And so when we sat down to do this evaluation, there were some challenges that we had to acknowledge up front about understanding APS. We knew there was variability across state and local programs. We didn't know how much. It'd never been documented. Now we have a pretty good idea. There's more than we thought, probably. When we first started this, NAMERS was in its infancy, and there was really no other data. NAPSA had done a survey back in 2012, but it didn't get at all the things that we were interested in, and it was kind of out of date. And there really, even as we started thinking about it from an evaluation perspective, we started poking around what are our frameworks that we have by which to organize, think about our evaluation. There wasn't one. And then the other thing we were faced with, and they faced the same question when they did the outcome evaluation, which we are not talking about today, was it's really kind of hard to define what efficacy and what good either client or system outcomes are in APS. There had been some work in that area, but not a lot of work. So we were doing some groundbreaking as we were doing this. Next slide, please. So why evaluate APS in this context? Well, there's three things that we wanted to do. We wanted to improve the programs. To improve the programs, we had to understand the programs. To understand the programs, we had to develop new knowledge about the programs. So a large part of what we were doing through this evaluation was building fundamental knowledge. Once we have that knowledge, then we can do some things to help improve the programs through various initiatives. And so through various ACL initiatives. And so the evaluation becomes a complement to other things that ACL is doing with NAMERS and particularly the voluntary consensus guidelines. Now even there's the research agenda that they have done. All of this then builds to trying to, with the ultimate goal of improving the overall system of APS. We've got a framework, we've got a knowledge base, we've got informed projects, and so hopefully we can move the whole system forward. Next slide, please. So we're now going to talk about the methodology. One of us is more qualified than the other to talk about methodology, and so I will turn it over to Gila.
Hello, everyone. I'm Gila Schusterman. As Carl mentioned, I've been working with Carl for the last few years on this evaluation. So I'm going to talk a little bit about what we have done. So you can go to the next slide. Our process, we had kind of several steps in our process. Our first step in implementing the evaluation was to build an evaluation design, identify our research questions, and identify the sources of data that we would need to collect in order to answer those questions. We built a logic model, which has served as a really important framework that's been a foundation to many pieces of our evaluation work, as well as work that's ACL is, several other projects that ACL is working on. The logic model, which we'll talk about more in a few minutes, delineates the context, inputs, activities, metrics, and expected results for APS. We conducted, as one of the early stages of this work, we conducted a literature review specifically focused on how APS serves individuals with disabilities. And then we implemented the evaluation in three major components. our first component was focused on state APS policies. The second component was focused on state APS practices. And then the third component combined analyses of these policies and practices with APS system level outcomes, which we can talk about more. Then we prepared internal reports for each component. We also repeated both component 1 and component 3 along the way, updating the data because everything, we've been doing this since I think it was 2018 that we began, or 17. So it's, things have changed and we've been trying to update and keep things current. So we had internal reports for each component, and then we are now finalizing a public-facing report which summarizes all of the components together. You can go to the next slide. So this gives you a little bit more detail on our stepwise 3-component plan. So component 1, the main focus of that was to review APS state policies. We wanted to document the policy framework for each of the states. This was, we really didn't have this information gathered in any way previously. For this component, we kind of did this ourselves. We reviewed and compiled state policy documents that we were able to find online. We did not go through OMB approval, which would be required every time when we gather data from all the states systematically. We did do that down the road for the practice survey, but for this first stage, we really just kind of gathered everything we could find. We put together profiles documenting basically the picture of policies in each state, and then we gave those to each state to review, and we then were able to implement corrections and additions and any changes that the state provided to us. So we went through that whole process in 2019. We then repeated it again in 2021. We submitted an updated report to ACL with profiles for each state. So that's component 1. Component 2 was looking at state practices. So for that component, we did a pretty large scale online survey that we administered to all state APS programs. And the idea of that was to understand a baseline to get a baseline of understanding of APS program practices. Then component 3, we created an analytic framework to examine these patterns and relationships of programs and policies with the system level outcomes. And we put a database together so that we could do statistical analyses looking at all these variables together. You can go to the next slide. So our data sources, we did use NAMERS data from agency component as well as case and key indicators to calculate the system level outcomes, and some of the variables for the policies we did use from the agency component. We have the policy profiles and the practice survey served as the main source of our predictor variables, and we also use data from the census for population. Our analyses are based on 54 state programs. If you're wondering how we got to 54, we have all states. We have District of Columbia, and then we have 3 states that implement APS separately in 2 different programs. So Louisiana, Massachusetts, and Pennsylvania have 2 different APS programs in each of those states. So we counted each of those twice. We included those 2 programs separately. Okay, go to the next slide, please. As I don't know if Carl mentioned this earlier, our main 5 domains that we've been looking at in terms of these domains of APS, we're looking at context and administration. It's kind of like big picture, how the state is administrating APS. What does reporting and intake look like in terms of who's responsible for what are the different criteria, how does investigation take place, lots of different aspects of investigation, post-investigation services in terms of what services are provided, to whom they're provided, who's involved, how things are decided. And then we also are looking at quality assurance, which kind of covers really all of those different domains, but how quality is assured across the APS program as a whole. Okay, next slide, please. And within each of those domains, we had a number of research questions. So we wanted to know what were the various administrative structures, policies, and practices, what were the significant obstacles or problems that APS programs are encountering, and what were recent practice innovations or improvements that they've implemented in order to address those barriers. And we're interested in the association of these policies and practices with the relevant system outcomes. We also looked at whether we could identify types of APS programs that share common administrative structures, policies, and practices, and whether the system outcomes might vary across those types. We implemented something called cluster analysis, which is kind of a statistical method to look to see whether these states or programs kind of shared characteristics and kind of like hang together in a type. Talk about more about that in a couple slides. So those are our main research questions. You can go to the next slide, please. So for the policy profiles, we were interested in questions such as who administers APS? Is it state level administration? Is it county administered? Who's eligible for APS? Who are mandatory reporters in the for that state in terms of who is required to report adult maltreatment? Are there different priority levels for maltreatment in terms of the reports being the responses to the reports, like the length of time that's required to respond to particular types of reports? Are there different categories with different requirements? Those are just some examples of some of the policies that we looked at. And then again, I mentioned that as part of the initial policy review process, we also conducted a literature review focused on maltreatment of adults with disabilities. That was kind of a parallel thing that we were also working on. The next slide. So the survey, that was, I imagine some of you on this call are familiar with the survey that we administered. It was pretty extensive. We asked a number of questions divided into several sections. We asked about administration and context, intake, investigations, post-investigation services, quality assurance. A lot of questions about staffing in terms of like who is responsible for what, how does the whole intake process work, hotline, all the different methods of accepting reports, timing, responsibility, how staffing works in terms of specialization, supervision, who is responsible for assessment, decision-making, and also tools. Are tools used? All the different possible types of tools for assessment, assessing client needs and capacity. We had questions about partnerships with other agencies and other professionals that might be able to support the investigations, and anyway, lots of different questions, which you'll see some of these details as we continue. We also asked, we had some open-ended questions in the survey for each domain about barriers that the program had encountered related to that area, as well as innovations that had been implemented to improve things. So we had really a lot of details that respondents provided, which was great. Okay, next slide. So our systems analysis, so the predictor variables are independent variables. We kind of called them both at different stages of our work. So the variables from the policy profiles and the practice survey served as those predictor variables. And then the dependent variables were the system level outcomes. And in particular, the variables we were interested in were reports per 1,000 adults, that kind of giving a sense of like the volume of reports that are being accepted in each program. what percentage of reports are screened in for investigation as opposed to being screened out, what percentage of APS clients were found to be victims. That's looking at substantiation rate, basically. And then what percentage of APS victims receive post-investigation services. So these are the variables that we felt kind of were associated with different decision points along the way of an APS investigation, and we thought we would get a lot of really useful information if we could find relationships between particular policies and practices and these system level outcomes. So that was generally what we sought out to do. The next slide, so the next slide talks about the cluster analysis that we also undertook. We used a technique called principal component analysis and k-means clustering. Those are sort of like the fancy statistical things that we did to look to see whether there would be programs that would kind of group together that would have common practices. If, like, we had 54 programs and we wanted to know whether, we could kind of get a sense of like types, they could be grouped perhaps into administration types or intake types or investigation kind of types. So we did actually find that they do group together in some ways. So we these analyses were fairly preliminary. I mean, this is something we'd really like to go back and try to look at again a little bit more, but we did learn some, we did learn quite a bit from doing these. We'll talk about some of the findings in a little bit. And I think the next slide goes to Carl to talk about our top 10 takeaways, or sorry, our findings overall, and then our takeaways.
Remember to unmute yourself, Carl.
The findings are interesting. What you're not going to hear in this presentation, with the exception of discussing the results of the cluster analysis, is any of that system analysis stuff. It's complicated statistically. It raises lots of questions we don't know the answers to. So read the report when it comes out would be my suggestion for those. So then, next slide, please. Let's talk about the APS TARC top 10 takeaways from the evaluation. So operative word here is APS TARC. This is not ACL's top 10 takeaways. This is just what we, in looking at this, thought was the most interesting, most potentially impactful on what is going on in the world of APS. It reflects the bias of our experience and our perspective on this. Somebody else looking at the data and findings in this report may come up with a completely different list of top 10 takeaways. And the reality is there is no way we can present all this data that we have in the time frame that we have. I'm not even going to give these top 10 takeaways their due diligence, really, in the time that I've got left. But we think these things are important. I think these are things that people need to know and understand about the APS system. And somewhere in here, there's going to be a moment for you that is a no-duh moment. And so we were doing this workshop. We were doing this presentation at the Texas APS conference last week, and with Stephanie from ACL. And Stephanie made the point, yeah, it may be no duh to you, but we now have the data to prove that it is no duh. So some of these things are things I think we knew and understood, but now we know that they are what they are, and we have data, and we can look at the relationship between them and some of those system outcomes. So with that intro, the top 10 takeaways are: the logic model was really useful for us, and it's an incredibly useful tool. Some of you have been exposed to it otherwise. APS has a unique legal ethical framework that's kind of centered on two tensions. This is maybe a no-duh to you, but we've kind of documented that. Eligible population is not the same from state to state. yet APS practice is not population specific. APS is administratively located and operated in different ways. There's great variance in what we call system outcomes, and we'll show you some graphs on those, but there is kind of a core set of practices that defines APS. So we have a core set of practices, but very different outcomes. Next slide. This 6 is where the cluster analysis comes in. What we found is that there's a pattern of more or less developed programs, particularly in areas of investigation and quality assurance, and I'll show you some data on that. When we look particularly at the qualitative input on barriers and service innovations and some of the other comments, there was a great concern expressed across the programs for better internal consistency in practice to get to a place of higher quality casework. Number 8 is APS supervisors are critical to program success. Number 9 is APS is dependent upon partnerships to be successful. And number 10 is kind of a process takeaway, kind of like number 1 on the logic model is. The data that we've gathered is really useful, can be used for further research. We use it all the time for technical assistance, and it's just going to further our understanding of APS going forward. It's not a one-time and done kind of resource for us. So with that said, next slide, let's talk about these top 10 takeaways. The APS Logic Model has been really useful for us. I'm not going to spend much time on this. We've talked about it a little bit already. It provided a great framework for us, and so some of you are used to seeing how ACL has used this in various ways for reporting and other things. It's really been useful for us. Next slide. Legal ethical framework tensions. So I want to talk about 2 tensions here. The first thing is a tension of APS is conducting investigations to address social work needs. You're applying a legal framework to a situation that requires social work. And so just things to think about. All but one program determines dispositions, the result of an APS investigation. Yet almost all programs at the same time are assessing their client needs holistically. You've got a program in which the same person on the same day can be investigating a case of sexual abuse and a case of maybe hoarding self-neglect. Just think about how different those things are, yet within the scope of APS, you're having to deal with both. You've got a wide range of models along this continuum between investigation and social work in terms of what APS does. You've got one big state that says they don't even conduct investigations, they don't reach dispositions. They fully acknowledge kind of that social services framework, and yet you've got another state in which the programs are operated through district attorney offices, and then everybody else is kind of in the middle. So you've got this tension of investigations to address social work needs. Next slide, please. You're providing protections while ensuring client rights. And you can kind of see on the slide here some of that balance between protection and independence. We've got data on what APS does on both sides of that scale. It's when you think about that, it suggests that one of the critical aspects, one of the critical decision points in APS casework is deciding about client decision-making ability, because that's kind of the hinge on which this balance works for good APS practice. The issue is, are you using the right tools to make good decisions? Have you done the right training? Do you have the right policy to help you make that decision about client decision making? Because that will then drive lots of other aspects of your practice. Next slide. Age and disability define the population APS serves. So this is a little matrix that shows how APS programs fall out in terms of the definition of the population that they serve. 34 states serve adults with disabilities regardless of age. And so everybody that's above the age of 18, as long as they have a disability, is served by APS. But then you get various permutations of how that works. You've got APS programs that everybody over age, say 60 or 65, is presumed to be eligible, while the adults must have some way of defining a disability. And so you can see in the bullets there how things fall out, and you can see in the matrix there where your program may be and how many other programs you are like. Next slide. That said, about the population, practice is not population specific. We ask in that practice survey in each of those domain areas, do you do things differently for different populations? And in general, the answer was no, we don't. We treat everybody the same. The only kind of exception to that was in nursing homes, sometimes the practice is different. And one could argue that's not because the population is different, it's because the nature of the setting is different. So APS practice does not seem to be very driven by the particular populations that it served. And the box there contains a summary of the disability literature review. There was not much literature on disability in APS investigations. That's kind of the first finding from that. It does clearly show, though, that persons with disabilities are subject to abuse. It wasn't real clear on what kind of vulnerabilities make them at risk for that. And then there was a need, kind of our big takeaways, there's a need for more consistent measurement and definitions and more precise identification of the types of disabilities and maltreatment, so that we can get to a place of enhancing the practice that we have and doing better research and making better policy in this particular area. This is an area, a frontier for more need and more exploration going forward. Next slide. So how is APS administered? There are various diverse administrative features. So we got a matrix here again. So we asked the question, where in state government is APS located? And we kind of came up with, is it located with the State Union on Aging? Is it located with the Child Welfare Agency, or is it somewhere else? And so you can see that State Union on Aging and other kind of both tied for that in the total column over there. We also asked the question, who is conducting investigations? Is it a state-run system or is it a locally run system? There are different models of locally run systems, of which county is the most predominant. And so you can see then most are state-run, about 16 are locally run. And then you get the matrix there, so you can see how things fall out across the two criteria, and you can figure out where you are in that box. So it looks like state employees and other health and human service agency is the most frequent model there. I will tell you that, is it aging, social services, or other? That is art, not science, in figuring that out for the agencies, because state models of organization are complex and none of them are the same. So we asked the question in the survey about, okay, so that's where it's administratively located. How does it actually work? How does the state exert control over what happens at the individual investigator level? And so you see some mechanisms here for that. 42 states, 42 programs indicated that they thought their control over local operations is significant. 9 indicated it was moderate, and it was limited in 3. And then the bars, counting the number of programs, indicate the mechanisms that are used, sorry, Andy, for that control. Not surprising, policy and training are the most popular. Research and evaluation is the least popular. Next slide, please. So then we wanted to know, okay, within that policy framework, how much consistency is there? And with kind of an arbitrary criteria of 80% of the programs have implemented policy that is similar in all of the areas that you see listed here. So eligibility, you remember we had those 34 states that are the same. And so over 80% of the programs have similarity in their disposition categories, and so on through all of these particular questions. So these are areas where there's kind of a core set of policy and practices. That's good, core set of policies and practices, but then what is the impact of that in terms of the system outcomes that we looked at, which is the next slide. And what we discovered is that there is great variance in the key decision points or the system outcomes in APS. So remember from what Gila told you earlier, we looked at kind of 4 places. Is the abuse, is the maltreatment reported? Is it accepted? Is it substantiated? And are we providing services to address it? And so the next slide looks at the first one of these. What is the rate of reporting per 1,000 adults? So we've got the number of reports that are reported in namers with just a simple mathematical calculation per 1,000 adults. And look at that. You go from a very, very small number on the left side of the graph to a very big number, 9, and that range is just incredible. I will say, if you look at this in terms of a bell curve, most of these programs fall kind of in the middle, but you still have this huge range of outliers, which indicates that there are some significant differences in the way APS is understood and responded to in different states around the country. So next slide is the percentage of reports that are accepted at intake. Same thing. You've got some intake systems that are accepting almost all of the reports, and you've got some intake systems that are not accepting very many of the reports. Huge range, huge outliers. This too is, I think, as I recall, fairly normally distributed, but more programs kind of on the outlier end of this, indicating that the intake models, the intake criteria that are used across the programs are pretty inconsistent, particularly in some individual cases. Next slide. So substantiation rate. This is just kind of straight namers data. How many of our clients are victims, and you can see nationally the average is 33%. And again, you've got low percentages and you've got high percentages here, indicating that individual state policy and practice as it relates to substantiation varies a lot in the outliers. This is another one where most of the programs fall into the middle with some notable outliers, and as I indicated earlier, there's one program that doesn't even do substantiation at all. This is an area I think a lot of folks are looking at. I think NAPS is even conducting a study of this, so hopefully we'll get some more information on what's driving this particular area. And then the final thing is the percentage of victims that are receiving services. This is coming again from NAPSA data, from namers data. And it's based on case component reporting, so there's not as many states here. Again, pretty wide range. We don't completely understand what is driving this difference in practice across the states. Obviously, the amount of funding that you have for services makes a big difference here, but is an area for us to understand. I will say in each of these 4 areas, each of these 4 system outcomes, we've got a better understanding of what is going on in the APS system. We have some understanding of what may be driving that through some of the systems analysis, that comparison of policies and practices, the association of them with the various outcomes. And so we kind of understand what is going on. In a lot of cases, though, I don't think we understand why it's happening that way or why it's that way. And so there's clearly opportunity here for some further research to better understand the system. So next slide. On to the cluster analysis that we talked about. So recall with the cluster analysis, what we're trying to do is use statistics to determine if there are groups or types of programs. It's as much, even though it's the data and the statistics that's driving it, it's as much art as it is science in a way. So we had a pretty good, smart team of folks, and we had a bunch of meetings to kind of work through the data and think about where the clusters are, what variables do we put in, what variables do we take out. And the way we came out of this was, is there a pattern? What we came out of it with understanding is that there's kind of a pattern of more and less developed programs in the country. I think we knew this anecdotally, but the data really supports that. And so we saw this in 3 areas. So you see services is not here. We never could find any patterns in the services data that made much sense to us. But for administration and investigation quality assurance, we did see patterns that made sense to us. There's a pattern of state versus local administration and control. There is a pattern in investigation of those that do and don't use what we call more advanced practices. And in quality assurance, there is a pattern of those that do and don't use methods that we think are more advanced. So that may seem esoteric to you in a way, so let me show you some data that kind of illustrate what we're talking about. Next slide. So this is for investigations. And so when you're looking at the orange bars, those are the percent of programs that have implemented a higher implementation, that have implemented a particular type of policy or practice that we consider to be of higher type. The blue bar is the percent that are at the minimal level in terms of the percent of programs. And so for each of the bars, then you can see the different types of policies and practices that we looked at, and you can see a real pattern here. There's for the programs that are in the higher implementation standards, you can see a much higher percentage than the blue bars for those that are in the minimal implementation standard. I'm not sure I explained that very well, so read the report. Next slide shows the same thing for quality assurance. And again, you can see for the different types of QA policies and practices that there's a huge distinction between those that are in the higher implementation of standard QA practices and those that are in the minimal implementation. So next slide, this is really not that surprising in the sense that this statistical analysis was reinforced by some of the qualitative information that we looked at. So recall that we had those innovation and barriers questions in the practice survey. We had the responses to the other questions in the survey. And as we looked through all of those responses, what we saw was a very strong theme of a need to improve intrastate practice consistency and quality assurance. That word quality and that word consistency showed up over and over and over again in terms of this is something that we need to do to improve, or this is something that we have done recently so that we can have better consistency and better quality. It was a consistent theme from many of the programs, particularly in that practice survey. So the next slide just gives you some of the areas where we saw that. What would be a barrier? A barrier would be various interpretations of cultural protocols. There's a need for equal adherence to policy when you've got nearly 30 supervisors covering 159 counties. You've got a program citing the differences in urban, suburban, and rural local offices. And those just give you a flavor of the type of concern that was expressed related to inconsistency and quality in practice. The next key takeaway, next slide, is that supervisors are critical to program success. And we asked some questions in the practice survey that tried to get at the role of supervisors in APS practice. And so a couple of key things here. One, as I'll show you on the next slide, supervisors are improved at critical case junctures, and they are a key part of the decision-making process in APS casework practice. However, on the negative side, in those barriers questions particularly, and we got a lot of response back that supervisor workload is an important obstacle to improving their program. So the next slide shows the supervisor and approval at critical case junctures. This comes from a couple of different questions in the practice survey. We asked whether the supervisor was involved. We asked whether the supervisor was required to improve. And so you can see in those case junctures that supervisor involvement and supervisor requirement to improve is pretty high across the board. This documents that we cannot put too much work into supporting and helping our supervisors, because if we're asking them to be involved in all this time to train staff, to approve casework, they are, it seems to me, our key leverage point for improving APS casework. Next slide. So that's internal. What about external? One of our key takeaways is that APS can't do it alone. You know, we rely on tools, partners, specialized staff, multidisciplinary teams, and various types of consulting professionals to help us make good casework decisions. Their availability and their use vary significantly across the programs. And so, you know, this is an area that we, like those system outcomes, want to understand better. One of the things that the survey data indicated is that the reliance on partnerships tends to be more local than statewide when it comes to assisting with investigations. Another example is that most programs do not use specialized staff or units, and they're dependent upon community experts for issues like capacity assessments, to talk about the thing that the decision-making ability we were talking about earlier. This is an area we, this year, are going to do some more work on, and I'll talk about that in just a second. Next slide. So here's an example of the importance of partnerships. We asked a question in the survey about who do you have a partnership, formalized partnership or protocol with to get access to coordination, to get access to records. And so you can see 38 programs have those with law enforcement, 23 have it with the financial community, 15 with the medical community, and 12 with other communities. So you can see partnerships and protocols are important, particularly for the relationship with law enforcement. We asked, next slide, a question about what types of access do you have to various types of consultation resources by different categories. And you can see that by category. Legal being the most significant, forensic science and forensic accounting being the least number of programs, although with the new federal funding, I know that the forensic accounting thing would certainly include several additional programs since we did the survey. we totaled them up and we said how many programs have 5 or more resources? That was 10. How many programs have 2 to 4 resources? That was 31. How many have 1 resource? That's 6. And how many have 0 resources? That's 7. As you sit here and you look at these bars on this chart, you can kind of see how this feeds into that cluster analysis that suggests there are programs that are more advanced in their investigative practice and programs that are a little bit less advanced in their investigative practice, with this just being one of the inputs into that kind of cluster analysis. So next slide, last takeaway is another process one on this data that we have gathered. So it's going to be very useful for us, has been useful to us already. We use it to respond to TA questions from programs all the time. Who does what? How do they do it? We're able to dive into the survey, give them counts or give them references to people that we now know have implemented certain types of practices. We can identify that from the program, from the survey, and we can make references to programs to help them find people to help them implement a best practice. We're going to work on some TA briefing papers next year, diving deeper into some of this data that's not going to be reflected in the final report. So we're going to do a paper on tools, we're going to do a paper on partnerships, and we're going to do a paper on something else I'm not remembering right now. And so all kinds of things that we can continue to look at. I've referenced a number of particular research questions that we might want to look at. I would flip the question around and say, what do you want to know more about? We would love to have that feedback from you. The subtitle of this webinar was "What's in it for me?" Well, this is where we're getting to that point. We want to know what you want to know more about. We've kind of got our research plan for this year and our briefing paper plans for this year, but we would love, when this report comes out, to get some more feedback from you on things that you want to know. With survey data, there's always cross-referencing of questions, right, where you can dive deeper into looking at the relationships of things. We'd love to hear from you to know more about what you would like to know about APS, because we now have some research data that we never had before to help us understand the system. So, next slide. There's a whole lot of data in this report. The survey was really long. The policy profile questions were like 15 or 20 of them. And so there's just a whole lot of data and interesting stuff that we have not had time to discuss today. And so we strongly suggest, if you're interested in this, that you read the report when it comes out, when published. And so we're thinking in the next month or 2, it will be published. We're coordinating the timing of that with ACL based on a number of other different things. But to help us get to this place, we want to hear some more from you about this. So once we get this thing published, we're going to encourage you to read it, and then we're going to have a listening session coming up in the spring where we're not going to talk. We're just going to let you guys talk about what you found interesting in the report, or talk about what questions it raises and what more you want to know that the report suggests we should spend some time thinking about in terms of APS. So be on the lookout for that upcoming listening session. Next slide. This is what to look forward to then in terms of deliverables and products. We've given ACL individual internal results on each of those 3 components: policy, practice, and systems analysis. So it's basically, those are reports that say, here, it's not the raw data, but here is all of the data. We're producing for you a public-facing report that kind of synthesizes all 3 components. So it's going to talk about the policy and the practice and the systems analysis as it relates to context and administration in one chapter. It's going to talk about policy, practice, and system as it relates to investigation, as it relates to services, as it relates to quality assurance. And so we're going to synthesize all that across those domains that we take from the logic model. And it will be a great resource for you to use to understand what's going on in the system and to really to kind of benchmark where you are relative to the system. We've also done conference workshops with this. We did a workshop at NAPSA. We're doing this webinar today. We did it at the Texas APS conference. Stephanie and I were talking. You know, this kind of lends itself to state workshops. If you're interested in those kinds of things going forward, get in contact with us, and we'll see if maybe something can be arranged for that as well. Last thing is, we know that a number of states with their formula funding grants are doing evaluations of their system, trying to understand where they may want to make improvements, how they compare to other state APS programs. This information is going to be a great resource for you with that. If nothing else, it's going to suggest a framework to think about your program. It's going to give you kind of some baseline data for comparing your program with other programs, and we think it's going to be a great resource for those of you that are doing your own internal evaluations, or those that may be thinking about doing an internal evaluation going forward. We are here to assist you with that, and so please get in contact with us as you're getting into those processes, and if we can use our data to help you in any way, we would love to do so. So next steps, next slide, to summarize. We're going to complete and disseminate the public report. There's a whole lot of understanding what is going on in the APS system. Like any good research, it doesn't always, and like any kind of good data analysis, it doesn't always tell us why. But we have a much better understanding of what is going on in the APS system, and we got some good questions to continue to try to understand why things are the way that they are. ACL is very interested in point number 3 here, in synthesizing a lot of the work that they have helped produce over the last several years from the outcome study. There's some interesting overlap between some of the findings in the outcome study and some of the findings in our evaluation work. There's a whole lot of qualitative information that was collected in the outcome study that's collected in our work. And so one of the things ACL wants to do going forward is to kind of synthesize all of that and see what it suggests when you do a synthesis type analysis. So that's something they're going to be working on. And then from an APS TARC perspective, we are going to continue, as I said, to try to translate into TA resources and products and be here to assist you with any kind of needs that you may have to better understand and improve your programs. And with that, I warned you we would run out of time. Krista, do we have any questions that we can answer in 1 minute or less?
Yeah, so we have a couple. The first one, for expert consultation, were both internal and external consultants included? And was this distinction differentiated?
Gila, help me out here. I'm trying to remember the specific survey question. I think we asked questions about both. I'm not sure we framed it exactly internal versus external, but Gila, do you remember?
Yeah, I mean, there were different, I think there were a few different questions in the survey about consultations, and some of them I think did specify like that they were, I can look, if the person who asked the question would like to identify themselves either to you or, I mean, we could probably answer that question more fully if we can just, with a few minutes and we can email you the answer if you're interested.
Sure,
Yeah,
sure.
we asked about both. I'm not sure we exactly framed it that way always, but we asked 3 or 4 questions about those types of resources. And you see our email addresses there.
Given that we're out of time, I'm going to send everybody's questions to the presenters. Thank you, Roberta. I'll share that information. Just one other quick question / comment, food for thought. My agency is trying to develop outcome measures in APS. We struggle with this because of the nature of APS. Protective factors for adults are different than children. How do we measure the effectiveness? So that's something for all of us to ponder a little bit more. And Kenny, I see your question. I'm just going to go ahead and pose it directly to the presenters since we are out of time. So thank you.
And so just real quickly, Chris, the ACL intends to publish the outcome study at the same time that they publish our kind of process evaluation. Between our system outcomes and the process evaluation and the client outcome study that New Additions did, you're going to get something of an answer to that question regarding outcomes.
Okay, great. Perfect. So more to come. Well, thank you both. My goodness, this is so much information and so exciting. Can't wait to read the report. I will share questions that we didn't get to today with the presenters. Thanks, Carl and Gila. Thank you for attending, and please join us for the next APS TARC webinar, Promising Practices Spotlight, partnering to provide direct client services on January 24th. That registration actually just went out today, so keep your eyes out via the TARC outreach channels and contact us if you don't see it. And enjoy the rest of your day, and we will see you next time. Thank you very much.